Well, welcome to the first ever Medipyxis podcast. We're here to highlight the top innovations shaping the future of wound care. When it comes to decision making, the majority of people rely a lot on experience and memory instead of structured processes. And while this is good to have, how can we reduce uncertainty and increase clarity in order to make educated decisions every time? Well, today we're joined by Katie and Nikki from Kindling Consulting, who have worked closely with wound care practices, helping them to improve clinical operations and their clarity. So please introduce yourselves and tell us about your background in wound care.
Okay. Hi, everybody. My name is Katie Koschel. I'm a doctoral prepared nurse practitioner, certified wound care, CWS, and WCC. I started out my career working with wounds in the hospital, trauma, general surgery, and burn. And then I transitioned my career into outpatient, brick and mortar wound care, hyperbaric center, oversaw clinical operations across the clinics, and then decided last year to step out into consulting. We really saw that our industry needed some stability, kind of moving the industry forward, standardizing everything. And so we felt like we could reach the most amount of people by stepping into a consulting role. And that's where Kindling Consulting came to be.
Love it. Yes. And I will piggyback on that from Katie. My name is Nikki Johnston. I'm the founder of Kindling Consulting. And I have been in the healthcare industry for well over a decade. Really kind of same pathway that Katie had, kind of fell into wound care from another healthcare space, and really just saw a huge need once we did both the hospital settings. Both of us were in the hospital setting, brick and mortar, mobile side of the business. We really realized that the wild, wild west was happening right in front of our eyes. And if we wanted to help move the industry forward, we were going to have to step up and kind of make some changes ourselves. And so this was our opportunity to step in and help some of these smaller clinics and other organizations move their practices forward in a standardized and compliant way.
Great. So, what led you guys specifically to start helping wound care practices improve structure and their decision making?
I think for us, it was kind of twofold. One, we had been on all sides of the industry, and so we saw the vast differences between what happens in the hospital from a wound care setting to what happens in clinics and what happens in the patient's homes. And we really saw an opportunity to align not just the processes themselves, but also the clinical decision making that was kind of embedded in those. How could we potentially step in and really move the industry forward? And that's kind of how we stepped into this, and why we chose to go this path versus maybe another path.
From your experience working with wound care practices, where do you see the biggest inconsistency in how clinical decisions are made and executed today?
I think that's a great question. I think from my standpoint, that wound care, you don't have to have any formal education or training to get into wound care. You really can kind of straight out of school or transitioning from a different specialty get into wound care. And so that lack of training or knowledge really makes the industry very inconsistent. And so providers getting into it, especially if they work for a company or don't have a good basis of the knowledge, they don't have a sequence to even follow. They're kind of just out there doing what they think they should do, and it's the wild wild west. People are not getting the care that they need and the time that they should. There's a delay in escalation, and we're seeing that patients are not getting what they need quickly enough.
Cool. So, like, when there is a structure in place, how does that improve impact production quality, the utilization, and how does it affect their overall efficiency?
Yeah, so when there isn't clear decision framework in place, care becomes inconsistent, not because clinicians are careless, but each provider is making a decision kind of in isolation. You'll see the same wound treated by three different providers, and it varies depending on who's actually on service that week. And so escalation is where that real risk shows up. Without those thresholds that are agreed upon, teams either escalate too late because they're hesitant or they're unsure, or maybe it's too early out of fear of denials or fear that maybe management will look to them. Why are you not doing X, Y, and Z with your patient? And neither is actually patient centered, and both ultimately create downstream problems. So, operationally, this lack of structure just slows everything down. Documentation takes longer, utilization review becomes reactive, and leadership spends more time resolving internal disagreements and actually improving care. And so a decision framework, it aligns everybody from clinicians, operations, compliance, and it's all centered around the same if this, then that logic. It doesn't actually remove the clinical judgment, it removes uncertainty. And when uncertainty drops, that efficiency, that confidence, and that consistency improves all at the same time.
I think the
Hmm.
consistency piece is huge in that conversation, because she's right. The confidence level when you feel like you know what you're supposed to do immediately increases. The more confident you become, the faster your decision making becomes. The easier it is for you to understand what step 2 looks like or step 3 looks like. And it gives you kind of a baseline internally to trust yourself to make the right next decision. So, having these clinical workflows and this decision making mapping on the front end and really letting the team kind of lean into that only increases efficiency down the road, because at some point they're not going to need it anymore. Like at some point, it's just going to become a tool that they've used to train themselves to be able to make those decisions independently.
Cool. So before the call, we were talking a little bit about this algorithm. I'm a little bit out of the loop on that, I feel like, but uh, basically to help you create the structure for these wound care clinics. Let's talk about the origin of that as well. So, like, at what point did you realize that this issue was not really lack of knowledge, but a lack of structure when guiding decision making?
Yeah, so I realized it when I kept seeing really skilled clinicians making different decisions for basically the same clinical picture. You could have two patients that have similar wounds, similar situations, but the same clinician that was very skilled was, making different decisions. And basically, that was when it kind of clicked. It wasn't a gap in the knowledge. It was more in their um, like planning, having a pathway. And so people knew what compression was, or when skin substitutes existed, why offloading mattered, but what they didn't have was that shared structure for when to move, what had to be true before escalating, and how to explain those decisions clearly in the plan of care. And so once I saw that, it changed how I thought about improvement. Education alone wasn't the answer. These are skilled, smart providers, but what these teams needed was a repeatable decision pathway that reduced variability, aligned expectations, and made good care easier to execute consistently, especially across different providers and different settings and throughout the weeks in the care plan.
I think the craziest part about it is that we saw it across all different sized practices. So even small independent practices that only had one or two providers were feeling the same way as larger groups that had dozens of providers across multiple states that have been working and been in the industry for a really long time. In fact, we kind of saw a little bit of a bigger gap the bigger the organization got, because the training itself started to change. It became almost unrepeatable the larger the organization became. And so these pathways that we're talking about, these algorithms, were developed to really standardize everything that the organization is doing, regardless of what setting they're in, what state they're located in, what LCDs and MACs they have. It's very specific to what they're currently doing.
Cool. So, what's kind of the biggest thing when they implement this into their clinician? What's the biggest change for them?
From my perspective, I think the biggest change is kind of a breath of fresh air. Like they feel at ease. They feel like the way that the algorithm is structured is very user friendly, very easy to follow, and it kind of takes the guesswork out for them. They don't have to put as much thought process and mental strain into what that care plan needs to look like, because it's kind of laid out for them in a step by step manner. Now, obviously, wound care is ever changing niche industry. So it's not going to be perfect for every scenario, but it really gives you a great foundational piece so that you can make better decisions quicker, and not have to invest as much of yourself into those decisions, especially in the mobile space. Mobile is about speed. We need to be on the road. We need to see the next patient. We need to make sure that patient's getting good quality care while we're there, and we're setting good foundational pieces. But we also need to do this incredibly efficiently because we're not able to see as many patients every day due to the travel. And so having this algorithm in place is an easy ABC to really performing excellent wound care.
Yeah, I agree completely. From my perspective, I was really thinking about clarity. Everything else really comes from that. When those clinicians have a clear entry point, they know their thresholds, there's escalation triggers, that consistency just follows naturally. And once those decisions feel repeatable and defensible, that confidence piece of it is there just all on its own. I really can't make people more confident. That's something you can't teach. That's something that just emerges when that structure that they're following supports that good decision making. They know that it's a shared logic. This is what we're assessing, this is what we're watching for, and this is what tells us it's time to move to the next thing. So really, that clarity first. They have to have a good understanding of where to start and what's our pathway going forward.
Awesome, yeah. So we're talking about clarity a lot. And so how does the framework support clinicians as they move from assessment to foundational care? You also have escalation decisions and integration of advanced products.
Yeah, so for me the whole point in this was I'm not telling them how to do their job. It really supports clinicians by defining what has to happen and maybe when. These clinicians know how to treat a wound, the what is compression, what is debridement, but this helps them move in a clear sequence. Let's assess first. Let's get all of our foundational care done. Let's look at that objective assessment. Let's reassess them. And only then we can escalate to those advanced products once we've met that threshold. And it protects clinical judgment instead of replacing it. So clinicians still decide how to offload, how to debride, which product fits the wound. But that framework ensures that those decisions are intentional, they're timely, and then clearly tied to the patient's presentation.
And I like, from a non clinical perspective, because I am non clinical, the flow of it is very user friendly. So it starts out really in depth, what is standard of care, and it lists that out for you, so you don't have to necessarily remember the 25 different items that fall under standard of care. You have a nice comprehensive list right there that you can reference and acknowledge if one of those pieces are missing prior to being able to move forward. It's color coded, it is streamlined, it flows in 2 to 4 week sessions depending on where the patient's journey is, and it's very easily laid out with a yes or no. Did this happen? If no, move to this section. If yes, move to this section. So it really gives a very clean layout that really anybody, clinical or non-clinical, can follow and understand and reference back. Like, this is great from an operational leadership standpoint, where you as a leader can reference this as you're having conversations with your clinicians and be able to speak their language, understand their decision making path, and help lead them if maybe a portion of that was missed.
Yeah, absolutely. And one of the things we saw again and again was just an uncertainty around maybe when do we use which product in which situation. We've got this insurance, that insurance. We have options for PRP versus a graft. when do we or don't do ultra mist. And so there's a lot of decision making that happens. And so those providers, they maybe understand and know when they meet that criteria based on the wound, but maybe walking them along where in the weeks or the time frame of the care that also fits in. So not only do we sometimes have a time constraint, but we also have a presentation of the patient constraint that they need to follow. And so the algorithm helps walk them through all of that simultaneously so they're not missing any pieces.
Okay, yeah. So walk us through kind of the, I guess, before and after. So what does it look like before they introduce this framework, and then also afterwards?
Yeah, so I feel like before the framework, when people would talk about stalled wounds, it's like, well, it looks about the same. Maybe it's a little better. We'll maybe give it another week. They're not really clearly defining. Has this gotten 50% better? Has this had a decrease in drainage? Is there more granulation? There's really no shared definition of what that progress is. There's no clear reassessment point. If by week 5 it's not improved, we need to do this, this, and this. And that escalation decision is kind of based more on a gut feeling or a fear that I need to implement this so management thinks I'm doing my job, or they want to help the patient, but it's maybe not within the right time frame. And so it's based more on those decisions instead of structure. Whereas after implementing the framework, that thinking more shifts to it's much more methodical. We've addressed perfusion, we've looked at infection, we're offloading, we're compressing, we're doing debridement. Now we're at week 4. The wound has not met that objective improvement criteria, the 50%, all the things, and now that tells me it's time to escalate. So nothing about the clinician has changed. They understand all about that. Their knowledge didn't suddenly improve, but what changed was the presence of that shared decision pathway. Everyone in the practice is looking at the same inputs, using the same checkpoints, and making decisions that are easy to defend and then repeat. They can continue to repeat it with other patients that they're seeing. So it's not really like better clinicians or anything, it's just a clearer decision making.
So you had mentioned that there's so much change going on in wound care. How do you see wound care decision making evolving over the next few years?
I think there's a couple angles to look at that from a operational standpoint. I would say we're buttoning up the ship. Like we no longer have the luxury of relying on skin substitute revenue to kind of compensate or skim over some of the things that maybe we were not real tight on prior to that. Now we have no choice. We have to make sure that every decision that we make is aligned properly, is aligned quickly. We don't have the time to make errors. We can't get a dozen different denials and hope for reimbursement on the back end. So I think from an operational standpoint, this is a pivotal time for wound care to really look at their processes across the board, above and beyond just the clinical decision making, but internally, is your routing plan in place properly? Are you being incredibly efficient with your staffing? Do you have all the right tools for your team to be able to do all the things that they can possibly do to heal that patient out as quickly as possible? I think what we're going to see in the future is going to be a shift in what right looks like as far as healing those patients out. And I think it's going to emphasize a lot on healing rates. And so making sure that going forward, we have good processes in place, good strategy, good alignment, efficient workflows. All of those things are going to compound each other to kind of reshape what wound care has been.
Yeah, absolutely. These providers are smart. Education is obviously the basis of everything in making sure that you're very knowledgeable in wound care, but the future isn't just about those smarter clinicians, it's about those clearer systems that support those smart clinicians. The advanced products, they're not going away, but they'll be integrated more intentionally. Clearer criteria, stricter reassessment expectations, and the programs that do well will be the ones that can combine that clinical judgment with the structure. So the care is personalized, but also defensible.
Yeah, it sounds very similar to kind of what we're doing with Medipyxis, right? Yeah.
Medipyxis in general is one of those software systems that our industry has been needing for a really long time. There's a lot of segmentation in wound care, there's a lot of systems that do not talk to each other, and it's very difficult to really track how well you're doing as an organization when you have 16 different platforms that your team has to utilize in a single day just to get one claim put through. What Medipyxis brings to the table is an opportunity for everybody to have full visibility across the entire organization, from leadership to clinical decision making, the billing department, your business development team. Everybody has insight into how the organization is functioning and how to move forward together as a team. So, what Medipyxis does is combines all of those different platforms in one simplified version, obviously backed by advanced AI that is really changing the industry right now as well. And as Katie and I have been talking, clarity, efficiency, productivity, clear workflows, those are all so important to wound care being relevant and wound care staying alive through all of these changes. And Medipyxis really positions the industry in a much clearer, much more concise way to really button up that ship, make sure that everything is working perfectly and everybody's in sync together.
Yeah. Very much aligned on a lot of stuff.
Yes.
But as consultants, when it comes to clinicians that want to be better long term, what should practices start building today in terms of their structure and their standardization?
Yeah, I think from my standpoint that practices should really be focusing on those decision points. It's not just about the products. You can implement all sorts of new technologies, all sorts of new advanced therapies, but unless you're agreeing on what gets assessed every time, what defines adequate foundational care, how that progress is measured, um, it's not going to be consistent across the board. And it's not going to be something that's easily repeatable or reproducible with other patients and across the board across all your clinicians. And so the second piece is that documentation alignment and being very careful to mirror that clinical pathway and assessment and intervention and reassessment. And so these decisions are easy to understand and defend. And then ultimately, one of my biggest things I've been preaching lately is that ownership matters. These pathways need to be owned by the clinicians and with a reviewed cadence and a process for updating them. And clinicians need to own what they're doing day to day. They need to not just think of this as visit to visit, but seeing as a continuum of their patient, and they're just as responsible from the visit 2 or 3 weeks ago to where they are now to what the plan is for the future. And that'll help prevent problems with consistency down the road. And so really ultimately building that roadmap now. It's much harder to install structure once you're already in motion. It's hard to stop everything and redirect where you're going versus just really starting at the beginning and being strong in those
I think
structures.
that's where Kindling shines. We can really come in, do that initial assessment, give you a very concise idea of what's working, what's not working. Because sometimes when you're in the middle of it every single day, you don't always see it. You're kind of tunnel vision. You're moving forward. You're just trying to get through the day, and you're not really catching a lot of the things that could be improved within the organization. So us being able to have that fresh set of eyes, be able to reassess what is currently being utilized within the organization, we can help navigate making certain changes. Katie does a fantastic job of going through and doing chart audits and making sure that documentation is aligned with medical necessity statements and the requirements for CMS. Especially with the changes with Wiser coming, these things are going to be really, really important for these organizations, and Kindling can help navigate that chaos for you and really kind of realign your structure and make sure that your teams have a solid foundation going forward.